Here's Glenn Woods on News Talk 1270 KIML.
9:06 the time. News Talk 1270 KIML, the radio station. My name is Glenn Woods. Thanks for joining me. For those people trying to call in, hold on just a moment because I got a guest, and I'm going to go ahead and take care of the guest. Normally, this is open phones. Joining us from Wyoming Liberty Group down in Cheyenne. What's your name and occupation, young lady?
I'm Regina Mina, and I am Policy and Legislative Affairs. I do mainly healthcare policy.
Okay, now healthcare policy is important. There's a lot that we have to talk about during the course of the hour. And, of course, you can find Wyoming Liberty Group for those who need to know it at what website?
We are at www.wyliberty.org.
Now, I know you got a bunch of stuff in front of you there, but before you get into that, I saw this morning, and I needed some help on it. I read it, and I didn't quite understand it. So Wyoming right now, the legislators are taking a look at Medicare. Is that right? What is going on with Medicare in Wyoming? I didn't understand the article.
Medicare or Medicaid?
Medicaid, thank you.
Yeah, they're looking at Medicaid. Well, what is happening is that with the Obamacare, the PPACA, it has increased some enrollment for the state of Wyoming, mainly in the children area. We also have the option of expanding coverage clear up to adults up to 250% of
Right.
the federal poverty level. They are looking at expanding up to 138% of the federal poverty level, and that's for childless adults and all the people currently who are not eligible under our state plan.
Now, let me be clear about that. Is that the state is planning to do this, or Obamacare, or the feds are planning to do this?
Well, the feds are planning to do this, but it's left it up to the states. If you remember, the Supreme Court ruling said you may not. Secretary Sebelius, you may not force these states to expand. So the conversation that's going on right now is, should we? Should we enroll these people into Medicaid?
All right, now, as it stands right now, does it look like that's something that they will do, or does it look like it will fail?
No, I do not believe so. Because for this reason, no matter what, at the end of the day, it adds tremendous costs to our current state budget. Everyone knows that. You have the Department of Health and other interest groups lobbying, saying, hey, this expansion is going to actually save us money. Well, you know, Glenn, savings is a wonderful concept. I mean, you start believing that you can actually afford a high-dollar item. But sometimes the cost is so expensive still, you can't afford to save that much. And it doesn't matter how much the federal government is going to pick up, we still have costs that are going to add to the budget. So people understand that no matter what we do, we're going to incur huge costs.
Okay, and as I look at this, I think I don't think the federal government has the money to implement anything that they currently want to implement. They are pretending, but correct me if I'm wrong, in the long run, the federal government cannot do anything that they're touting that they're going to do.
You are absolutely correct, and here's really the reason why that is, and people are still trying to grapple with it, but it's the truth. Glenn, we're running out of people.
Mm-hmm.
The lowest birth rate since 1920 was achieved last year.
Right.
So when you have all of these federal programs that require new taxpayers to come into the system every year, and that taxpayer base is shrinking, instead of being a pyramid where you have a whole bunch of taxpayers supporting one entitlement draw, it flips down and you have 2 or 3 taxpayers supporting 10 or 12. That's why they are very adamant in saying by the year 2034, in 20 years, Social Security is insolvent, and that's why. We're running out of other people's money, Glenn, because we're running out of other people.
Right. Well, and of course, Margaret Thatcher said the problem with socialism is you run out of other people's money. Any other grand plans from the state of Wyoming that we need to know about involving our health care?
Well, we have some positive, actually. Okay. Well, I do consider it positive that they're not at all inclined to jump in and expand this Medicaid program, but there's a bill, House Bill 125, and it's an interstate purchase of health insurance. This bill If it goes through, it's going to be in the Labor Committee, House Labor Committee on Monday. If this bill goes through, it's going to begin to allow Wyoming citizens to purchase plans in other states that have the benefits that we want. So we can join other state risk pools. It begins to build that risk pool that is the huge reason why health insurance in every single state is so horrendously expensive.
Well, and you and I, correct me if I'm wrong, I'm very libertarian-ish. My attitude is, boy, I should be able to buy health care from some guy in a grass hut in Zimbabwe if I want to make that mistake. But instead, we have state reciprocity because each and every state has their own rules. So we would have to, Wyoming citizens would be allowed to buy from states that we've made an agreement with because of that. Is that right?
Well, no, it's not an agreement. It's not a compact. See, that's the problem with compact legislation and why it doesn't work. Compact legislation actually says, let's all make these humongous, useless regulations the same for every state. So for Wyoming, we have less coverage mandates, for example. That's just one aspect of it. We have less coverage mandates. If we're going to make a compact with Colorado or whoever, we would have to import all of theirs. So it doesn't get us anywhere when you have to import regulations. What Wyoming's doing is a very bold move, is that we're saying, hey, look, the regulations that exist in Colorado, Nebraska, Idaho, Nevada, you keep them. Wyoming residents, they're going to be fine in here. So we will honor your regulations so that our citizens can purchase a plan from you with your regulations and your coverage mandates. That begins, Glenn, and it's going to take some time, but it begins that move to where you have consumer-driven insurance. It puts the control back into the people, not the health insurers, definitely not Obamacare, and not employers.
Right. It's customer-based at that point. So in other words, the more people that I can draw or the more states I can go to and the more companies that I have the option of buying from, the more power I have as a consumer.
Absolutely. Don't we do that with automobiles? Mm-hmm. Absolutely we do. That's a contract. When you go to buy an automobile, say in South Dakota, and because it's a great deal, you can get it cheaper there. Okay, so you go and you buy it. They're having a sale. That's a contract that is enacted there in South Dakota. If you come back home and you find that the warranty or something's wrong with it, you don't get to go to the car dealership in Wyoming and say, fix this. You go back there. Everybody understands that. It's not a risk, it's an intelligent move, and people choose to make that move if it works for them. We don't have that luxury right now with health insurance. It's shoved down our throat, and we're told only what is licensed in Wyoming is the only thing you're going to have.
I'm talking with Regina from Wyoming Liberty Group. Are there legislators that are worried about perhaps giving up control? Because, you know, people in government love to have that control over us in one way or another.
You know, it's not so much the control, but here's one of the arguments that has popped up. They're worried about consumer protections. Mm-hmm. And again, you know, I've had to talk about this, and I will continue educating them on it, but the consumer protections are already established. They exist in each state because, again, it's contract law. Right. Every state's insurance department is where you go to begin your dispute resolution. And if you cannot solve it, you are allowed to hire an attorney and go after the insurance company. Everybody.
Or to put that another way, if I make a contract with an insurance company and they break that contract, I have the right to take them to court, and that should be enough to settle it right there.
Well, it is, because that's the funniest thing, because that's how it is right now. Mm. It's just that they're trying to scare people, saying, oh, all of a sudden, these consumer protections that you now have in Wyoming and that the people in Nebraska now have, they're not good enough if Wyoming people cross over to Nebraska. Mm. It's silliness. It really is.
All right. Now, let me ask, because I was wondering where there's so many bills that move around so fast. I don't know from one day to the next or 1 hour to the next where anything is. There was a bill that was offered up that would fly in the face of Obama healthcare exchanges. Where is that one at?
That bill is not going to come out this year. Okay. I think the major bill sponsor, he has so much going on. And that's another thing that the governor has done and the legislature has done, is they've said, look, we've already decided we're going to have Secretary Sebelius come in, use 100% of her money to establish this thing. And when she can establish it and certify it's operational, and when she can verify it is self-sustaining, Wyoming will jump in. Thank you very much.
In other words, what the governor had said to Sebelius in his last letter was, Kathleen Sebelius, who's in charge of Obamacare, is okay, we're just not going to make a move. It's up to you to come into the state of Wyoming and set it up if you want.
Mm-hmm.
Yeah, which of course, again, they don't really have the resources to do. The federal government does at this point. So we should be safe for a while anyway, huh?
Well, with the Supreme Court ruling that said, hey, it upheld the law, and when it upheld the law, what the law specifically said is the secretary shall establish an exchange in every state.
Right.
Well, all those poor states that jumped in and used their own money under the guise of having control with this state-based exchange, they lost out. They used a lot of their their own money, and this thing will not work because you cannot get affordable insurance out of it.
Right. This is something I've been saying for a while. As maddening as all of this has been, don't worry, folks. It all falls apart because at some point you do run out of other people's money. It's going to really stink because, I mean, we're talking about a financial collapse across the board. But, hey, you know, if they mint $1 trillion coin, we'll be fine, right? Okay. I got to pay some bills. I'll be right back with you in just a moment. Hang in there, folks. And, yes, the voice is doing a lot better. Hanging in there. It's starting to come back. I'm less raspy than I was before. Regina joining me from Wyoming Liberty Group down in Cheyenne. Now, but I've got a few more questions for you. But first, is there anything that I'm missing that I should be asking you about? Anything going on down there right now that we should know about?
Well, there is another bill that will be moving through the Senate, I believe is where it started. It hasn't been to the committees yet or been through the committee, and that's Medicaid eligibility. And what they're trying to do with that bill, it needs to be killed, by the way.
Right.
But what they're trying to do with that bill is take the current Medicaid program that all the specifics and requirements that are in our state plan, which is the contract with the federal government. They want to take everything that's in the state plan that we can amend every year if we want and put it into state statute. So effectively you're creating a dual system so that if for some reason a new legislature comes in and says, hey, we're not going to get into this Medicaid program anymore. We're now, because we have beefed up our private insurance group, we're going to start allowing all these people to have affordable coverage in the private insurance industry. What they'd have to do then is also go back and amend the state statute. So this is a very bad move. We don't want this bill. I'm not sure that it's going to get any traction because the overall thought right now with our legislature is that we're not going to be moving on any Medicaid expansion right now. There are too many questions. And that's a very wise move. They were wise to not set up an exchange. They're wise to take this very slowly. Okay.
Now, I read a story around 6 o'clock this morning to the audience. I think it's in Pittsburgh, I believe, or somewhere around in that area. There's a hospital that has decided they are not going to be delivering babies anymore, and that's just because of Obamacare. They're not going to get enough reimbursement to take care of the doctors that they need to take care of, so they're just simply not going to do it anymore. And that's been a problem around the country, a creeping problem as they continue to implement Obamacare. And I know several doctors in this area, right up here in the Campbell County area, who are looking at problems like this as well. So even whether the state of Wyoming implements something or whether we let the federal government do it, we could even wind up with a bigger doctor shortage in the state of Wyoming because of all this, couldn't we?
Yes, absolutely. Again, what it comes down to is for the longest time, these hospitals have depended on the middle class to pick up the costs from the difference between what these government-run health programs pay and what the hospitals and everybody need to cover their costs and their profits. As the middle income people drop out of insurance and as we drop out, period, because we're not being replenished as much, then they're losing. And it's a very plausible scenario, and it may come quicker than we all think.
Well, and I'm wondering if it come quicker for us in the state of Wyoming because we have such a small population, such a small base to draw from.
No, we've been steady.
Okay.
Very steady. Because we haven't overutilized and expanded a lot of these federal programs, we still have a rather healthy private market. And so that's where it's steady. And this is proof positive that you cannot have these such a huge influence of these federal programs on there because they can absolutely tank the entire healthcare system.
Is there any other plans offered up by any other state legislators, anyone around the state that could block what's coming from the federal government, or are we still just going to be in a wait-and-see mode for a while?
Honestly, Wyoming's ahead because, and with all the other states that have said, look, here's the deal, you set up your own exchange. And when the Supreme Court ruling said, look, you do not have to buy insurance, you cannot force people to have insurance, they must have a choice, they pay a tax or go without, or have insurance, then everybody else is dropping out. So it's not workable. It's going to implode on its own if we just hold steady.
Yeah, okay.
So that's my thing. Hold the line.
Might have a call for you here. This is Glenn. Who's on the phone? Okay, maybe not. Thank you for coming on. I appreciate it. I believe Maureen is up next, right after you. Okay. Hang in there, folks. More with Wyoming Liberty Group in just a moment.